Well, nature's response in argument of stability is going to be to try to stabilize this area before it forms crud, thickened tissues, bones, for anything it can to hold it together. And it may reach stability. The natural history of a spondylolysis, so we know 5% of the population has it, is pain in the back at one of two phases in life: adolescence. Severe onset of back pain, typically associated with activities that require extension. Football linemen, basketball, volleyball players, ballet dancers, kids that develop back pain. You get an x-ray, you see that you have this defect. Okay, that's one. Typical presentation is somebody's in their 40s, 30s or 40s, they have an episode of back pain, they develop some leg pain, and we get x-rays and we see the structure with a defect. And that's kind of where you stand here. Misdiagnosis in age 13, current diagnosis now. Not that they would have done anything at age 13.
Yeah.
Okay. The other issue, though, is because this arch is not intact, and because the purpose of the facets is to control directionality of the spine, when you have that defect, you lose directional control. And so what may happen over time is a gradual sliding of the parts on each other. That's called spondylolisthesis. Spondylo for spine, listhesis means to shift. So it's a product of instability. And instability the way a glacier is unstable. You'll walk on a glacier, you'll play on it. You just won't build a house at the bottom of it. Okay, it's all a question of time frame. Okay? So that's what we got going on here. Right? So here's your studies, and understanding all of that, you can really parse together what's going on with you, causation versus circumstance. And then we'll talk about what to do about it, but I think it's really important to understand all that. Okay, so here, okay, here you are. And, let me show you a 20-year-old, okay? Or just an unremarkable back, just so you have a comparison. Nice natural curve. All the blocks of bone are square. Discs are nice and tall, and they increase in height. The peak raised here, slightly decrease at the lower level. Notice how every block lines up. Every corner to corner to corner lines up. Okay? Spinal canal is right here. Okay? So that's what we like to see. Here you are. Okay?
So,
okay. See all the blocks. First off, with regard to the discs, okay? The discs here, you can see that these are kind of disproportionately narrow. This one's okay. A little bit narrower. This should be bigger than that one. This one. So look, I'm seeing degenerative processes. Does it mean you hurt or have problems? Not necessarily, but I'm just saying I see degeneration. By definition, then I also know you must have some degree of stenosis, okay, with response to that. What I mean about the alignment is, here's the lock. Here's the lock. Here's the lock. Oops. Supposed to happen. Here's the lock. Okay. This is a 50%, what we call grade 2.
So
This is supposed to be back there.
this one is supposed to be back there.
Correct.
And these are supposed to have more
Yeah,
space.
two separate
Create the
issues.
space.
Two separate issues, yeah. One of degeneration and one of subluxation or shifting.
So this is the
Okay.
L4.
L5, S1.
L5. Okay.
Here's the thing. You can see how nature's responded. Formed a large spur of bone,
Okay.
really tried to weld this together, stabilize it, okay? And here's the thing. Look, this didn't happen overnight.
No.
okay?
Yeah.
And the issue is, to ask is, why is this a problem now?
Yeah.
Okay?
Yeah.
And that's why we get these studies, okay? The most important study is the X-ray of you bending forward and back.
Mhm.
Because it's the only study I know you're alive. You could be dead in the MRI and I would know, okay? This is
Was
only
that the MRI, the one we just looked
Well,
at?
no, that was
No, we
an
haven't
X-ray.
gotten it yet.
Yeah.
Okay.
Okay, an X-ray of you moving under circumstances of gravity tells us the most information on the function of your spine,
Okay.
okay? So here you are bending forward and bending back.
Right.
And the thing to look at is there's actually no motion between these levels. Okay, in other words, nature's reached
So that's
some
good,
form of equilibrium. Okay?
Alright.
It's reached some form of equilibrium. If you want to see the defect, there it is right there.
Mhm.
See how this is an arch? See how you're looking at this as an arch right
Mhm.
there? There, there, there's the gap right there.
Mhm.
Okay?
Mhm.
And indeed, when you bend forward and back, the gap doesn't change. It's not like it's springing,
So
it's
it's-
open. So what I'm telling you is, look, this was your problem in 8th grade.
Mhm.
I'm just not absolutely sure that it's your problem now
No.
with regard to your leg. It may be part of the problem with regard to your back pain, for sure. What really is the issue is the altered mechanic,
Mhm.
because now you're forcing all the load to this level,
Mhm.
and particularly to the facets above. Okay?
Mhm.
Why? Because as you slide forward, nature strives to find center of balance, and so it throws you back.
Mhm.
Okay? As you go back, you lean more on the facets. Okay?
Mhm.
And in particular, you also load the disc. So, that's okay. Just leave it there. So having done all that, now we look at your MRI and make, we can make sense of it. Why? Because look, you're lying down in the MRI, you're not doing anything for it, okay? So here's the thing. With regard to your back, MRI is a large magnet, measures the water in your body. By the differences of water concentration, the computer creates contrast. Let's make water white,
Okay.
let's make the water black, okay?
Okay.
So this is an image, it's not a photograph, it's like a weather map of Tahoe. I'm not in Tahoe, I don't know what it's like. But if it's raining on my map, I can presume it's wet in Tahoe, okay? So here's the blocks of bone, here's those levels. This is a good looking one.
Mhm.
You'll notice just about
Those are a
every...
little smaller, I think.
Yeah, you'll notice every level is, showing degenerative changes. Here, these are getting dark and narrowed, and this is that one level over the years that, like a glacier, has ground itself down,
Mhm.
okay? You've lost the disc height,
Mhm.
you're quite degenerative, but this may be to your benefit, because this is nature having stabilized
Right.
this segment.
Right.
Okay.
Keeping it solid. Yeah.
So it's hard for me to understand why you suddenly would have problems there until we look far to the side, and here's the nerves as they come out the windows,
Mhm.
okay? Well, there's no window left for that one nerve. And this is the nerve that goes down the leg and goes to the outside of the calf and the outside of the
Mhm.
foot, okay? Here's the thing though, there's no room on the other side either. So why do we have problems on just one side
Mhm.
only? Particularly if we're making an argument that this is mechanical instability.
Mhm.
And, and this is the progression of symptoms, and that's why your legs hurt, okay? So now we have to look at the level above. If we look at the level above, notice how this disc protrudes out?
Mhm.
See how it kind
Yeah.
of squishes out, okay? And indeed, if you look like a motion picture, suddenly see this big thing honker out right there? That's a herniated disc,
Okay.
okay? It's a herniated disc from the level above.
From above.
It's L4, L5.
Okay.
Okay, so that's a statement of mechanical causation.
Mhm.
This level worn down perhaps has reached some degree of mechanical stability,
Mhm.
accommodative to your current demand. And then what kind of given away is this herniated up there. Okay? And what's a herniated disc? It's where the central part of the disc extrudes. It's the jelly coming out of the donor. It's a sign of degeneration. Okay? It's not an event, it's a process.
Mhm.
You wake up in the morning, your car doesn't work. Okay. Do you really think it broke that night? Of course not. Okay, it's up to a point of
From a
attrition.
process,
Yeah. Okay, it's super important to go through an analysis like this, because we really have two separate issues here to us and to you. Back pain and leg pain, okay? Back pain here represents you reaching the mechanical threshold of the stability that you had, okay? It seems that this is stable and the mechanics is changing at the upper level. That's reflective of having the herniated disc, okay? Leg pain is purely coming from the herniated disc. Even though this is super narrow like those other areas, I'm a little bit hard to understand why it's worse to the right and not at all to the left when both look like real crap.
Do you think
Okay?
because
But
well,
you've reached equilibrium. And your nerve said, you know what, I'm okay with this little room. Why? Because it happens slowly over time. Whereas this herniated disc is a sudden boom and your nerve says, whoa. Okay? This is a big deal with regard to how to approach it and now what we're trying to help. Look, regarding your leg pain, the natural history of a herniated disc is 8 out of 10 people spontaneously get better in 2 to 3 months. Your body doesn't like this material, it's very inflammatory, it tends to dissolve and resorb. Okay? So the prognosis for improvement is reasonable for sure. Okay? You're not in any danger, you are uncomfortable, but you're not in any danger. The purpose of the injections, the pain medicines, all the voodoo, is to buy you time, to let nature take its course, to dissolve this fragment away. Okay? 2 out of 10 people, look, it's too much of a mechanical instruction, it's not following the natural, typical history, and you don't do better. Okay? And those people require surgery. Okay? Now, with regard to surgery to remove a herniated fragment to improve your leg pain, look, it's really like taking a rock out of your shoe while you're wearing it. Okay? Technically. You know, let's make your shoe the canal, let's make your foot the nerve, let's make your herniated disc the rock. I can take the rock out of your shoe while you're wearing it, no problem. What I can't do is fix your shoe for why the rock got in there. And that's the real issue here. Okay? Surgery itself as a procedure, you know, we've got to be careful of what it creates and where you're